Hey everybody, I'm Dr. Chris Dobzyniak. I'm the Chief of Interventional Radiology with Medical Center Radiologists and the Medical Director for Interventional Radiology at Norfolk General Hospital. So as an interventional radiologist, we get to be involved in a lot of things. And really, that was one of the big interests for me, for both coming here and becoming an interventional radiologist in the first place. We get to be involved with the full spectrum of care. And for me, it was the oncology aspect of it was really important. So we get to be involved from the very beginning of the patient's care, from their diagnosis, from tissue procurement, from biopsies, to then offering therapies, whether it's chemoembolization of a liver cancer or a radioembolization of a liver cancer, or ablation of a renal tumor. And ultimately, we get to follow those patients off and out when therapies are no longer options, and we get to be involved in the palliative components of it, where we're really offering them things that are making them more comfortable and improving their quality of life at the end. And being able to be involved in that full spectrum from a clinical standpoint is really what's been important for me. I think one of the things that's really drawn me to this area and to this field and to this practice was that we really focus on it being a clinical interventional radiology practice, which is a bit unique across the country and within the area. And sort of our philosophy on that is that we're going to be very involved in the patient's care. We're going to be one of their doctors, one of the members of their healthcare team that's really going to allow them to improve their quality of life, get the best delivery of care, and be available to them. So part of my philosophy about all this is I'm one of their doctors. I'm going to be involved in their care, and I'm going to be available when they need me. So one of the things that brought me here when I came out of my fellowship almost 11 years ago now was just the quality and breadth of the practice and the opportunities that we had. I knew I wanted to be in an environment where I could continue to be in a teaching situation. Residents and teaching residents and medical students and fellows keeps you fresh, keeps you on your toes, and keeps you very engaged in the latest and greatest things. I also wanted to be at a big hospital. I wanted to be at a flagship institution, and that option became available to me to be at Norfolk General Hospital. We're a quaternary care center. We're a level 1 trauma center. The other specialists in the hospital, the other practices in the hospital are really the best of the best, and we're able to offer the full spectrum of very high quality care where we're not having to send patients out to other institutions to get it. We can do it here. I think some of the things that are really interesting in our field now is the growth in the ability to deliver oncologic services. And some of these things have been around for a while, but we're really getting to the point where we can tailor them very well to the patient, where we can really deliver them in a complex fashion. And really where we're going with oncologic services is the ability to sort of integrate different therapies. An individual patient may get a chemoembolization, they may get a radioembolization, and then down the road we may have to do something else. We may have to add in something like a microwave ablation or a cryoablation. So really I think it's the integration of care, the refinement of how we're delivering these things, how we're choosing them, how we're integrated into their oncologic care as a whole, and how we're really becoming another pillar along with radiation oncology, medical oncology, and surgical oncology. Now exists interventional oncology. So we've really allowed ourselves to become a player at the table. And we've seen that really as we've developed tumor boards that have allowed us to really deliver much better care to patients.